I'm Dr. David Hill, and today we're going to be talking about earache in infants. Now, earache, of course, just describes pain in the ear. The problem with infants is they can't come up to you and say, "Hey, my ear hurts." How do you know? Well, part of it is age. It is very, very rare to see an ear infection in an infant certainly under 2 to 3 months of age, and really under about 6 to 9 months of age. Ear infections don't tend to occur in younger infants with the frequency that they do in older infants. That's not to say that they never happen. They certainly can in some children who are susceptible, and we start looking at infants' ears pretty much as soon as they're born to see how things are looking in there. I have seen ear infections in children as young as 2 months old, but not very commonly. More often you see ear infections starting between 6 and 9 months of age. Now, one of the advantages of those ages is that children are coordinated enough to actually reach their ears and grab at them. Now, not every child with an ear infection will pull at, dig at, or point to the ear. Likewise, a lot of infants in this age range are just taking inventory. They're finding out what they have. So I see a lot of babies who are grabbing at their ears, pulling at their ears. The parents may be very concerned that there's some sort of pain in there. We look in and we see beautiful eardrums. There's nothing wrong in there. It's just a child who's going, "Hey, check this out. I got an ear over here. Did you know that?" They may even find it calming to pull at their ear or grab at their ear, and there's nothing wrong with that. So without an otoscope to look in there, it's very hard to know what's going on. Now, there are some risk factors that you can be looking for. Ear infections almost always come with an upper respiratory infection or cold. So usually we see this in a child who also has recently had or currently has a runny nose or a stuffy nose or a cough. A fever is a big tip-off, especially a fever that's over 102 degrees or a fever that's lasting more than 3 days in duration. I always want to see inside the ears for that. A child who's excessively cranky, who doesn't want to eat, may have an ear infection, and you can't always expect them to be going after that ear. I've been surprised many, many times by what I see and by what I don't see. Now, unfortunately, in terms of an ear exam, you really do want a qualified medical professional doing that. It takes thousands of ear exams to get really good at knowing what you're looking at and seeing some of the subtle findings that can suggest an ear infection or clear an ear. So the bottom line is, if you're worried, you really are going to want to take that baby to his or her medical provider to get a look in that ear and see what's going on. Talking about signs of an earache in an infant, I'm Dr. David Hill.